Regenerative medicine is an exciting new area in aesthetics where you basically are taking substances from the body, such as cells or growth factors from the blood, and using them to restore, to repair, to rejuvenate tissue that's been damaged. That damage could be from radiation, could be from scarring, such as in acne or other types of traumatic scars, could be from prolonged sun exposure, which is a form of radiation and thins and prematurely damages the skin, leading to skin cancer in many cases. So regenerative medicine really is about the most natural treatment of all, which is using your body's own capabilities to restore something and replenish it. So it's quite an exciting time in our profession. Platelet-rich plasma, often called PRP, is taking a portion of the patient's own blood, this is part of regenerative medicine, and taking and concentrating it by processing it, and we take the growth factors which are in the serum of the blood with the platelets in higher concentrations because they contain signaling factors. These are proteins that tell cells what to do. So when we add PRP to the skin, for example, it stimulates growth in the skin where there's been thinning or damage. We use it topically in microneedling, which is another form of regenerative medicine where you're placing tiny surgical little punctures in the skin with these little needles to turn on the body's processes of healing, and that will stimulate more growth to damaged areas. So we use PRP with that. We can add PRP to fat grafts, where we take fat out of the body and we add PRP to it to get the double benefit of stimulating these cells and rejuvenating wherever we put it. We use it in breast cancer patients who've had radiation. We use it in scar tissue. We use it in cosmetic procedures such as in facelifting and all types of resurfacing, laser resurfacing on the skin, which can make the skin look years younger by basically using the body's own natural abilities. That's the best part. Regenerative medicine has a number of applications. Some are reconstructive, such as in injuries, where you can try to restore damaged tissue, and some are aesthetic to improve appearance or youthfulness. The portion of the fat contains special cells called stem cells, and they can actually become any type of cell. They have this pluripotent capability. So we use stem cells with our grafts to place them into an area where there's been damage, and the stem cells, with the signaling from PRP or other growth factors, can actually become new, undamaged cells and restore the area that we placed it. We've seen amazing results in facelifts and in aesthetic facial surgery. We've seen this in restoring damage to the breast. We also use it in more elective procedures, such as in breast augmentation, where we will add fat grafting to implants. We can use that in breast reconstruction or regular augmentation, or in the buttocks to restore volume. The biggest benefits of regenerative medicine are really to be able to attain more youthfulness and healthier skin and tissues by using your own body's natural components. And that means that you'll have a longer lasting effect, you'll have a more natural effect, and because you're using the body's own components, you won't have allergies or reactions to other types of things that are typically used in the past in medicine. So it couldn't be more natural, and the long-lasting effects can be really prolonged with good skincare and other things to give an indefinite youthfulness to the skin.